Okay, welcome back. This is our series on root cause of hair loss. We're going to talk about hair thinning, shedding, and breakage. All things related to hair. And I'm so excited today that I have a special guest on, Suzy Foote. And we're going to be talking about something really tender, right? We're talking about hair loss. And I shared my story with you guys on a previous episode, how devastated I was when I started noticing hair changes. And I thought it would be helpful to have someone else that's walked this journey a lot longer than I have, come on and just share part of their story. So, Suzy, thank you for being on, to be so vulnerable to share this aspect of your life. Because I know when I called you about this, the next time we talked, you're like, it kind of spun me up. Right?
It did.
It got me emotional.
It hurt my feelings.
Yeah, yeah.
I don't think about it very often, individually, but I just kind of keep going. But I'm sure plenty of people notice that I am missing some hair.
I think you do a great job, honestly. I really do.
You.
I mean, I think you've done a great job of not only treating
the
hair, but also the way you take care of yourself. I mean, you're a vibrant female, you're out in the community doing all the things. So I don't think that's the thing that people notice.
Yep. Mm-hmm.
Yeah.
Distraction.
The art of distraction.
The art of distraction is right.
So Suzy, if you could think back, when did you first start noticing hair loss? Because we know that for most people, they've got to have about 50% loss in follicle to really be aware that I've got a problem.
Right.
Now, people can see shedding, like we see shedding in the shower, right? But what did you notice first?
Well, I went to chef school up in New York, and while I was up there, I contracted Shigella, a very hideous food poisoning, and I had to have some, the worst antibiotics, a whopping, I had IVs in both arms going 250 an hour.
So how old were you then?
I was 30.
Oh, wow. So this was young.
Yeah, I was 30 years old. And I was about to, actually I was 31 because I was about to marry Ashby. And I got sick that summer, and half of my hair fell out.
Wow.
I mean, it was just like instant hair thinning overnight. It wasn't any spotches or...
So no bald spots.
No bald spots, but just...
Massive shedding. And
fortunately, my hairdresser at the time said, "Where's all your hair, Suzy?" And I said, "Well, I don't know." But she had to do a little song and dance to get it to look good for the wedding, but we did. And then it came back. I was able to recover from that. And then I started noticing it again when I was in my 50s.
So around menopause time.
Yeah, menopause. Yeah, exactly, menopause time. And I was very blessed in many regards with menopause. I just kind of hit that sweet kitty pillow, and that was all I had, except for my hair fell out. And so you were treating me at that time, and I was in a very stressful nursing administrative job, and when I go back and look at pictures from that time, you can see a very clear. It was very evident because my hair was much darker then, and it was quite noticeable.
Yeah. So what Suzy described early in her journey was hair loss associated with an illness, right? And it was diffuse hair loss. And that is a very common hair loss to have with illness, trauma, surgery, childbirth, transition hormones. We'll see massive shedding. And a lot of times it does stop within about 8 weeks or so, and then it does grow back.
Right.
But it typically doesn't grow back the same volume. Right. But we're okay. We're like, okay, things are good.
Yeah, things were rocking along. It wasn't noticeable, and I never would check the box and say, yes, I've lost hair. I mean, it just kind of went away, and I was busy raising children, and I never really thought about it. And then I got in this high-stress job, and all of a sudden, it was like I had this little patch up in the front, and it was I had to blow dry my hair a certain way to get it to go away, so to speak. And then I used some of that spray paint, scalp spray paint.
Right.
But then I decided it wasn't better, not going to use that because then that would hurt my scalp in the long run. And then I ran into Kelly, and then I started doing several other treatments.
Yeah. So if I'm remembering right, at some point we initiated red light therapy.
Right. I came
Right.
in with the original, like the freestanding hair dryers.
And we still have that in the office.
Yeah.
We still use it.
Right.
It works really, really well.
Right.
But it's red light therapy that stimulates the mitochondria. So
Right.
the mitochondria, your follicle, your hair follicle has mitochondria, which is the powerhouse of that cell. And it helps that hair grow and regrow. And so that red light therapy helps stimulate mitochondria to regrow hair.
And
so,
I would just like to say that I love my mitochondria. And that's what I do is I take good care of my mitochondria.
well, you just said a mouthful. It's so important as we age.
Yes.
Really, it's important when we're young too, but by age 30, we're losing the density of the mitochondria that we have
Right.
in our bodies in general. But hair takes a hit.
It does.
Oftentimes it does. Mm-hmm. Yeah, so you use the red light.
Use the red light. I was in a position to do PRP.
Oh, we did do PRP. Right?
Yep, we sure did. And then several times, and I had it demonstrated for me in Florida by one of the top plastic guys down in South Florida, and PRP is a great tool, except I'm so exquisitely sensitive that it hurts.
Well, I am exquisitely sensitive too. And I still offer PRP in the practice for hair loss. It is a phenomenal tool
Yes.
for hair loss. It does work, but it is very, very touchy. So a few years ago, well, I guess a year and a half ago, we got introduced to Derive, which is the plant-based stem cells
Right.
that we now can use ultrasound to drive in.
Ooh.
So that is a phenomenal treatment for hair. And it's just a joy not to have to use the needles for most people. We still use
Yikes.
PRP. There are people that want to layer those treatments.
Oh, nice.
So they may have PRP and they may have
Right.
Derive. But I think that things have evolved.
They sure have,
Just like-
because I've been busy with my Bella, and I didn't know about Derive. I need to come have some Derive.
Yes, you do need to come have some
Yes.
Derive. We absolutely will make
Okay.
that happen.
All right.
But it's fascinating to see. We started off with the freestanding light, and now we have at-home laser caps that people can take home and
Yes.
use in the comfort of their own home.
Yeah.
And then we had PRP, which is still great, but painful to your point. It's just we're taking your blood, getting the growth factors off, and spinning them down, getting the growth factors off, and injecting back into the scalp.
Right.
And then we microneedle that. And so
Right.
it's layering of those therapies that are important.
Okay,
So
good.
if you had to speak to yourself younger,
My younger
your
self.
younger self, when it comes to not only your hair, but just health and wellness, what do you think the things would be that you would say? And I'm thinking specifically about the stress. You know?
Well, I would tell my younger self, hey, Suzy, your body is talking to you. Listen up. And I think that so many times when we're busy being important, busy being in charge on our unit, busy running a family, and busy, spinning 15 saucers at one time, we don't take the time to listen to our bodies. So we don't take the time to honor what our bodies are trying to tell us. And I would definitely say, Suzy, you got to manage your stress better.
Right.
And your body is telling you that this is too much for you personally. May not be for somebody else, but you got to be you. So I would give my younger self permission not to have to be so high functioning.
Yeah, awesome. So if you're struggling with hair loss, I think going through a list of questions, right, that you would ask yourself in order to know, like, when you should seek treatment. So when did it start? Did it start after an illness, after a surgery, after a trauma, after a childbirth, or a transition of hormone time,
Right.
like menopause, right?
Right.
Have you been experiencing prolonged stress? To Suzy's point, stress can impact, the follicle's just so sensitive.
Right.
It's sensitive to that hormone DHT, dihydrotestosterone, which men and women have, by the way. And it's very sensitive to cortisol, the other hormone.
Ooh.
Right, that can get excessive during times of stress.
High stress.
So,
yeah, I was a cortisol queen for a little bit too long.
And then, did you take steroids or did you take antibiotics? And to the answer to the first question, when you first had your hair loss, you were on antibiotics, right?
Right, on antibiotics.
So that may have stimulated some hair loss for you. Medications oftentimes deplete nutrients.
Oh, yeah, I know. Well, fortunately, I'm very fortunate that I don't have to take too many medications. But over the years, I have had these little dips, where you fall off the cliff and you have to have steroids and antibiotics. And in Mississippi especially, we get very allergic during certain times of the year, and I would just want to punch it out so I could keep going.
Right. That's a common trap people fall into. And PPIs, medications that lower stomach acid decrease your ability to absorb key nutrients like B12, and that can make a big impact on hair too.
Right.
Is your hair breaking or is it falling out? Because those are different issues. Breakage, I think more about thyroid hormone and issues with thyroid. Falling out is a follicle issue. It's usually stress,
follicle.
DHT.
I'm a follicle girl.
Or nutrition, right? Do you smoke?
No.
Right? Smoking decreases blood flow.
It sure does.
Right? And blood flow to the scalp, that's one of the things that we look at with the dermoscope is we can actually see blood flow. And so,
you're so smart.
We know, like if someone's smoking or if they have microvessel disease, that hair follicle is kind of the last thing to get nourished. And then, do you style your hair with traction?
No, I'm very kind to my hair. I use organic hair products.
Tell me about that.
I do. I'm not sure they're actually organic. I use clean products. I go to a organic spa or salon, and I'm at that age. If I was I dye my hair, and I just and they use foil so that it doesn't doesn't bother my scalp, and it makes a really big difference. And then I massage my scalp.
Love it for blood flow.
Yeah, I'm always. Have you ever tried one of those little octopus things? Those are lots of fun.
Those are really good for blood flow. I would encourage you guys to do that.
Yeah.
And they have those little brushes now that you can just use to massage the scalp too.
And they sell that at my salon, and I have 2 of them, as a matter of fact. And
so did you get Ashby to give you a head massage?
Oh, well, I'm not going to tell. So anyway, it's, just the adding up. And then as I've gotten older and retired, I don't have to wash my hair nearly as often. So I don't feel compelled to wash and style every day. And then that makes a big difference on shampoos that you use, how harsh they are. And they strip your color. They just, do all kinds of stuff. So I try to be as kind as I can.
Absolutely. So I have a feeling you're using Aveda products.
I am using Aveda.
So those are organic, right? They do have, for people that are gluten sensitive, some of their conditioners do have gluten. They use wheat as a protein in some of their conditioners. So check that label for that. But they are organic. And the other thing is they're not adding petrochemicals to that follicle that would make that follicle toxic. The products are not going to damage your mitochondria in your hair follicle, right?
Got to keep those mitochondria happy.
So one of the things that happens with traditional product, even cleaner products, is they can contain things that block the follicle.
Right. I don't want anybody blocking my follicles.
Yeah, no blocking of the follicles because nutrients can't get into that follicle. Right. So all the good conditioner you're using won't get where it needs to go, and then you'll wind up having poor quality hair.
Right.
So I'm glad you brought that up about hair products. That's really important.
Right. And then hairstyle. I wear my hair up a lot of times, and then when I wear my hair down, I've got a lot of hair in the back, and it looks great. But when I'm this is the best style for me because it's kind of messy, and so you don't see a real part. It's distracting in in people's in others being able to focus on so it just kind of keeps them moving. Keeps the eye moving.
You do a good job. You look fabulous. I think you look fabulous.
Thanks.
So research tells us that the Mediterranean diet is the best diet.
Oh, my favorite.
For hair. So tell us how you eat. Like, do you think about that when you're eating? Do you think about what does my hair need?
What is my hair? Well, I'm not sure I actually think about what is my hair look about.
Collagen, right?
Oh yeah, I am using collagen, and I've switched over to liquid collagen because it absorbs. It does a better job. So I'm really excited about that. And I can tell a difference in my skin. And my hair grows fast. I mean, my nails, my hair, everybody's in there just growing right along.
Right.
And I was looking at some list somewhere, and I pretty much do all the things you're supposed to do. We eat
like nutritionally. Good for
we
you.
eat very clean. The clean 15, the dirty dozen. We stick with that. We eat organic meats. We eat. I've got my winter garden is in. I dug up my front yard.
I'm coming over.
My winter garden is in our front yard. I called the neighbors up. I said, hey, listen, I'm losing my sunlight in the back from our trees, and so I'm digging up the front yard. Sorry, not sorry. And so I go out in the morning and I pick 5 leaves of kale, collards, and broccoli, and stick them in my protein shake, and
makes a little smoothie.
How
fresh is that?
To be able to pick and eat is it's a whole nother level of gastronomic joy.
I love it.
Yeah.
So Suzy, you're a chef.
Yes.
You're a mom.
Right.
You're a nurse.
Yes.
You're a Healing Touch certified practitioner.
Yeah.
What am I leaving out?
Oh, well, remember I got certified by Functional Medicine Health and Wellness Coaching.
Oh, that's right.
Right. And I'm a grandmother, and let's see, and I'm a friend.
Yes, and friend. Friends are
neighbor.
Important. Yes. I love it.
Yeah.
I mean,
cheerleader.
You've just done so much.
Connector.
I love that about you, that you're a lifelong learner.
Yes.
You're always pursuing the next thing, like how can I be better as just a person? And I think that's
it makes life much more interesting. That's for sure.
It does. I'm sorry, I got distracted.
Oops.
So back to food. I'm going to give you some general guidelines to follow. Of course, avoiding sugar.
Ooh.
Sugar really damages the mitochondria. It steals the nutrients that your cells need to drive the mitochondria, honestly. And so sugar is probably the number one toxin that no one talks about, right? We don't think about it as a toxin. We think about it as a treat. Alcohol is also a toxin. We don't like to think about that, but it is. Alcohol can decrease nutrient absorption, but it can also decrease blood flow to the scalp. So I would say limit alcohol, limit or eliminate, if you can, processed foods.
Right.
I mean, they are anti-nutrients. They're stealing your nutrients. They're stealing your good groceries. Protein. Protein is essential for muscle. Protein is essential for hair. So Suzy mentioned collagen, and she's doing some liquid collagen.
Right.
She's getting her protein in her protein shake too.
And another thing I've recently fallen in love with is cottage cheese. I started putting cottage cheese in the days I don't have my protein shake. I'll have cottage cheese in scrambled eggs, and that gives it a really big bump, and it is delicious.
Yeah. So making sure, of course, you're getting organic,
whole. Yeah.
I love it. I love it.
It's quite tasty.
And then getting in your good fats. Right?
We love avocados, olive oil. Yes, I haven't. We've changed out our oils in our house 10 years ago. We're doing it. We're doing the thing. Yeah.
And I would say if you're struggling with malabsorption, if your GI health is not good, if you can't absorb the nutrients you're getting in, that would be a priority to work on too. Because if you can't absorb the nutrient, you can't get it to the follicle to grow that hair that you're wanting to get. And then beyond that, food sensitivity testing. If you have sensitivities to foods and you're not sure what they are, investing in some testing to see, are there things you just need to be leaving out for a while you do repair, right? So that you get the best result possible. So I want to ask, I know that you had a pretty severe episode of COVID.
Oh,
We have flashbacks of that. We were talking about that
Right.
earlier. And I had really forgotten how profound that was for you. But
It
you
was.
were early. You were one of the first people.
I had the real COVID.
You had the real COVID.
I had the
and it
real
was
COVID,
the real deal.
double pneummonia.
Yeah.
And I was letting my nurse practitioner up the street take care of me. And he wanted to hospitalize me not once, but twice in the progression of it.
Yeah.
And he said, if you change one hair, you have got to go in. And I did not, as a nurse, I didn't want to go in there and die, you know.
Right.
So Kelly helped me, brought over, bottles of electrolytes. I was pushing fluids. I knew what to do, and I knew I was okay. I knew I was very sick, but
Right.
Yeah.
Amazing. Do you feel like your hair took a hit
Oh yes,
after COVID?
yes, it did. And interestingly, one of the things, I hope it's okay to talk about this, that I did when I started, when the fever finally broke after 26 days, can I just say? I mean,
Wow. It was severe.
It was really bad. I started getting night sweats. My body was trying to detox. And I read somewhere where that if you do a coffee enema, that will help clear the stuff. And I've never had night sweats ever. And I was going through 4 pairs of pajamas a night. And it scared me. I mean, night sweats really scared me because it was completely out of control. So I ordered my stuff. I got the organic special coffee you have to get. I followed I think it's the Breston, the protocol. And I did that. And that night, sure enough, my night sweats broke. And so in fact, I just recently ordered some more. I said, honey, guess what we're going to do?
Well, that would be an interesting date night.
We're not doing it on date night.
So you saw shedding after
I
your
did.
episode with COVID. And it was probably more diffuse type loss.
Diffuse, but it was, my skin, muscle wasting, I just didn't move. And I was just loaded. I had to rebuild. And I'm telling you, it took me really and truthfully a year to get my feet back on the ground.
Yeah. So we've seen that a lot. So for those of you guys that struggled with COVID and had hair loss after COVID, that is a very common thing. I think when I look at my symptom intake sheet in the clinic with patients coming in, I used to see hair loss occasionally. But it's like common. Like I would say every 1 in 2 patients, that is their primary complaint is hair loss since COVID has happened.
And environmental toxic exposure with perfumes, home scent things that you plug in, laundry soap,
there's
all these different things.
A lot of factors that can contribute to the reason why we might have hair loss related to an insult like that, right? So as we were saying, we have seen hair loss associated with COVID. We've also seen hair loss in the community associated with GLP-1 use, and I should say misuse, because I see a lot of patients on GLP-1s that are not changing their diet. They're just using the medication. And we have a full podcast on Is This a Miracle or a Menace on the Synergy side. I would recommend that you listen to that because I think it can be both. I think it's a phenomenal tool, but if it's not used properly, we can sacrifice nutrition.
That's just it. And I did use GLP-1 for a while, and it really helped me lower my blood sugar, which I was struggling with. When I stopped drinking, I interestingly spiked up on the sugar.
And that's common.
It is. Yeah. And I just, so I've been able to get that back down under control. And then I stayed on GLP-1 for a while as a maintenance dose.
Right.
And then right now I am currently off of it, but I'm watching it
But that you used that tool after you became nutritionally balanced.
And
it was used as a tool,
as
not
a tool,
as
a crutch.
Yeah.
And that's just it. Is that my one of my friends was, oh yeah, I do it, and then she'll just it doesn't match up. And I say, GLP-1 is a great tool to use, but you have to add the behavior component.
Right.
If you're not adding the behavior component, and that is, have you changed your diet? Have you changed your habits? Have you added melatonin? Are you sleeping? Are you working out?
Right.
So the whole thing.
Right.
So that's
So through the course, because obviously your hair loss that you experienced postmenopausally was hormone related.
right.
Are you doing any hormonal therapies?
No.
Okay.
I am currently not taking any medication and just doing the supplements, and my lab values are...
Isn't that awesome? Isn't the body wonderful, though? Because, your ovaries make sex hormones. We know this for females. But 50% of your sex hormones come from your adrenal glands, right?
And guess
so
what?
if you get your adrenal glands healthy... right, then you may not need to be on hormone replacement therapy. But hormones can be a beautiful part. I am an advocate for measuring those, not just
you
prescribing.
did. You tested.
Yeah.
Yeah.
So when we look at hormones, we're looking at cortisol levels. We're looking at thyroid function. So TSH, free T4, free T3. We're looking at just basic labs like CBC and chemistry just to make sure that there's nothing underlying like an anemia that would be contributing to hair loss. So we don't want to make assumptions that it's just stress or it's just hormones or it's just nutrition. We want solid facts about what does need to be evaluated. So blood testing is really important. Sometimes with hormones, we'll use salivary testing or even urinary testing to make sure we get the most accurate reading.
Right.
And then we use a dermoscope in the clinic where we actually look at the follicle.
Right.
Do we see evidence of DHT? And if we see evidence of DHT, what are our modalities that we're going to go for, like the red light therapy?
Right.
Well,
that's the beauty of what you do. I tell people all the time, Kelly Englemann micromanages my micronutrients and my micro lab values because it's a drill. It's not the standard lab values that she's looking at. She's drilling way, way, way down and looking at the odd little details that can add up to, a much bigger picture. And so you have, a much better chance of solving your problem than just, rocking along.
So we recognize that hair loss for females it can be traumatic, and it's not easy to navigate. Typically, once that process starts, even if it was brief, like the episode that Suzy had early in her life and it seemed to restore itself, a lot of times there's still things going on underneath the current. So I think if you have hair loss, it would be best to get in and just get an evaluation, see where you are, see what tools can be used early to help restore that mitochondria. Because as we mentioned, mitochondria decline with age. And we're not changing the clock. The clock is still ticking.
Tick, tick.
Thank goodness, right? I want to be here for that clock to tick.
I do too.
But we want to make sure we're doing our due diligence when we do our workup. And we want to make sure that we're using the right tools at the right time to get the result that we're looking for. Not just short term, but long term.
And that's it. In a nutshell, we have information now that can really help and restore and level things out. I mean, I'm still aging every day, but I'm aging well. And I really appreciate that, Kelly. And I'm very blessed to do that.
We're blessed to have you in our wellness community. And thank you so much.
You're welcome.
For sharing your story today. And I hope it inspires some of you guys.
Yes.
The Enhanced Wellness Living podcast is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice, and no doctor-patient relationship is formed. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining professional advice for any medical condition they may have and should seek the assistance of their healthcare professionals for any such conditions.